India's ambulance drivers stretched to the limit. Day and night, they ferry COVID-19 patients across the city. But in these dark days, they end up at crematoriums more often than hospitals.
Since this morning, I have responded to 6 calls. Not a single one of them was from patients. They were all requests to transport bodies.
It's not quite what they signed up for, but they get on with the job, even when the call-outs are personal.
I was carrying bodies for other families. In here is the body of my elder brother's wife. Today I realised the pain that others were going through.
Death inescapable for those on the front line. At 26 years old, Rohan Agarwal is yet to complete his medical training. Yet he's been working 27-hour shifts at this New Delhi hospital under the most harrowing of circumstances. The facility has the capacity to treat 275 patients. It's currently caring for 385. A sheer lack of resources means that each day Dr. Agarwal is faced with an agonising decision: who to save and who not to save.
We are not made for that. We are just humans. And at this point of time, we are being told to do this.
The young doctor haunted by the sounds.
Sound is continuously in our head, even while we are sleeping. That beep, 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 beep. That casualty noise, the ICU noise.
Still, so many are dying because of acute shortages. 5 lives lost at a hospital in Uttarakhand state because oxygen simply ran out. In New Delhi, among the hardest hit cities, there is still a relentless demand for the precious resource.
I've been waiting here since 4 in the morning yesterday. One night and one day has passed.
But at this hospital in the capital, one of the largest in the country, 2 massive medical plants are being installed with the capacity to generate 1,000 litres of oxygen per minute. Still, critics of the Modi government say it's far too late.
A second wave was never off the table. You just had to look around the world. You don't have to be a scientist to say that. We did nothing. Instead, we celebrated, a bit too prematurely, Indian exceptionalism.
As supplies slowly trickle into urban areas, there are growing fears for rural India, home to 70% of the country's almost 1.4 billion people. Yet healthcare in these areas is extremely limited. One charity working in the villages of Uttar Pradesh, which is home to 200 million people, has reported deaths in almost every second house.